So in terms of the current treatment landscape for ALS, the first therapy that was approved by the FDA was Riluzole therapy. And Riluzole was clinical trials in the early 1990s. We were involved in those studies. Unfortunately, there was no further FDA approval until Edaravone in the past year or two. So there are now 2 FDA-approved therapies. There's been a recent application for Amylox 0035, which is currently being considered by the FDA. But what I would say is that as a result of the Ice Bucket Challenge, the funding that has come into the fields in general, there are just so many clinical trials underway at present. And, I think we're going to have a much brighter story to tell patients and, better outcomes. I think it'll be like cancer was 2 to 3 decades ago. Probably put them on 4 to 5 different medications. Obviously, we need to stratify patients in terms of a more precision approach to their therapies. And so one of the trials that we're about to commence is using lithium therapy in a subgroup of ALS patients who have an UNC13A SNP. So those patients normally have a very aggressive form of the disease, and we hope that with lithium, it'll be a slower form of the disease. The other therapy that I think is right on the cusp now are the genetic therapies for patients who have genetic mutations linked to ALS. So the antisense oligonucleotide studies, ASO therapies, are under trial for SOD1 and for C9orf. I think we're going to see a lot more directed genetic therapies for patients who carry these mutations.